Danielle. I'm going to be talking to you about lead testing today. But before we get into kind of the how-to, we're going to talk about when you would test someone for lead. So anyone who's foreign born entering the country needs to be tested. Also, anyone from ages 1 to 5 years of age who is eligible for Medicaid or Head Start needs to be tested. Lead can be absorbed through the skin, through inhalants, also dust particles, and also food and water sources. So the most common source of lead is going to be lead paint. And anyone who lives in a home that has been built before the 70s is going to need to be tested due to the high levels in the paint.
I'm going to go over the lead test preparation. So what we need is to gather our materials, and first we gotta gather our gloves, hand sanitizer, lancets, 2x2s. We're gonna need a sample collector and a collection tube, some droplets, and the lead care tube, and as well as the machine lead care number 2. To begin the test, we want to make sure we have the right patient. Perform hand hygiene and put on your gloves. You want to take the alcohol pad and clean the area. We'll take the lancet and wipe the first drop of blood. You're going to take the collector tube, grab it from the green area, and fill it all the way up to the black. This is going to require a lot of milking, so you gotta have a good strategy. Once you get enough blood, you're going to take the plunger, open up the lead care tube, and drop the blood sample in the tube. Once that is in, you want to close it and mix for about 8 to 10 times. In the meantime, you want to take the sensor and place it in the machine. Once you're done mixing the substance in it, you will open it up, use the plunger, draw the blood sample, and place it on the X.
Our patient's results back from the lead screening, we're going to want to discuss with them what that number actually means. So anything greater than 5 micrograms per deciliter indicates that that patient has been exposed to some source of lead, and they're going to require frequent monitoring and visitation to ensure that that lead level is not increasing. These lead levels are also associated with some learning difficulties in children. Anything greater than 45 micrograms per deciliter indicates that the patient has lead poisoning or lead toxicity, and they're going to require medication and also chelation therapy to decrease that lead level, because these lead levels are associated with seizures, coma, and in some cases death. Once we get our patient's results, we're going to want to give our provider a report using the SBAR method. So we're going to use Jessica as our clinical case study. So Jessica, or her situation is that she is a 4-year-old going into the Head Start program. Her background is that she lives with her mom in an apartment in Manassas, and she's Guatemalan born. Her assessment revealed both unremarkable neurological and physical assessments, and her lead level was 2 micrograms per deciliter. Our recommendation for Jessica and her mom are that we educate mom on signs and symptoms of increasing lead levels in the blood, and also we reinforce to mom that Jessica's lead levels at the time are appropriate and acceptable.